We have two patients ready there, and we'll start with three people scanning. It will be Lucas Wilhelm, Gianluigi Pilou, and Bernard Benoit. So can we switch on to the ultrasound and the lights down, because it's as dark as you can. If you can eliminate all the light, it will be better, because we don't need, there is no speaker in the front.
Okay, I'm online?
Yes.
Okay, so hello again. I want to start and I want to show you the features for a diagnostic of orofacial cleft. So I start here. The child is lying with the head down, and I'm starting here with the transthalamic horizontal plane. So now I go down, and you know not a lot about the fetus now, but you know that there's no palate, no cleft palate, because you see here the equal sign. And this, ich mache es sofort größer. Okay. 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 So this is the easiest approach, and you see it lasts only a few seconds. And if you have checked the brain structures and you go down with the transducer in this direction, then here you find soft palate. And I'm turning now into the coronal section. Then you see the epiglottis, and upon the epiglottis you see soft palate here. The uvula is not so long here. You see when swallowing the movements here, and this is a point you can rule out the cleft palate within a few seconds, and this works very good. So if the end of the palate is closed, you go to the beginning of the system or to the start of the system, and you see here the lips. The lips are closed, so if the lips are closed and the uvula is okay, so the space between is okay too. So you can be sure here's no cleft. If you have this section, it makes sense to turn into a little bit oblique view to check the lateral ends of the mouth. It's a very rare condition, but sometimes you can find lateral clefts. So if you would find a cleft here now in the lips, the next step would be to check the alveolus. So this, you need for this an axial plane, and these axial planes are not so easy to get. So I push a little bit the fetus in this direction. And then, yes, then we have, stop. The alveolar ridge, and it's surely intact. And the points where you have to search for the clefts is this and this. This is a so-called premaxilla. Here's the incisive foramen, the border between secondary and primary palate. And this is the part wearing the incisors, and here are the canine tooths, and this here are the points between incisors and canine tooths where you have to search for the clefts. And the third step would be to show the soft palate in the mid-sagittal section, and that is this one here. Stop. Okay? You see here clearly the soft palate here ending with this smaller uvula, and so these are the steps you need for the diagnosis of orofacial clefts in 2D. Ready, right? Is there something I should show again, or otherwise I would give the transducer to the next speaker. No, I don't think so. Perhaps you can make it clear with the color Doppler, but I think a structural defect you should see on the structures, okay? And perhaps if there are big clefts and affecting the hard pellet too, it can be useful, but I think it doesn't work for the clefts in the soft pellet.
If you have questions or suggestions, I can say to them because we don't hear you when they are inside. So, now Gianluigi Pilou will do the brain from BPT to Sulci.
Dr. Pilou from Italy, nice to meet you.
So Lucas, it was convincing what you showed us, and from tomorrow we'll have all the equal sign.
Is it a boy or a girl?
Not completely.
I guess very much. Yes, as soon as possible. Can you hear me?
Yes.
Okay. So we start from the standard axial views, which are the most important ones, and we'll do a wool sweep starting from the top of the head of a baby, which is in a cephalic lie, and then we go down, and then we see the frontal horns. We can see the cavity of the septum pellucidum right there, going all the way, that are forming the medial walls of the lateral ventricles. You can see the choroid plexus of the lateral ventricles. And from here, you can start seeing the deepening of the insula. And as you can see, it goes down quite steeply. It is right here like triangular, and then it becomes clearly rectangle. Here we are at the level of the atria, and we can see very well, the parieto-occipital sulcus. And if we rotate a little bit, we can also see the calcarine fissure right there. See it? If you, as Laurent Guibault suggests, want to standardize the measurement of the lateral ventricles, that is a good landmark. Caliper? Thank you. So we use these, and we take them. Sorry, I did something wrong. Next. Okay. And then perpendicular like that. And then we go down, and we are in the posterior fossa. And the best proof of the presence of the vermis is this view right here that demonstrates the fourth ventricle and some tissue posterior. In between, that is the vermis. Fourth ventricle, which is slightly lower than the level that you would measure the transverse cerebellar diameter. In this scanning plane, you can see very well the Sylvian fossa, and this machine has an excellent resolution. You can hear pulsation, you can see the pulsation of small vessels on the surface of the brain. This is the subarachnoid space, and it has some granulations inside. Now, we have seen very well this half of the brain, not seen that much of the other half. And the simple suggestion by John McGann was to incline the transducer slightly, to tilt it slightly, like this. And you can see very well the cavity of the lateral ventricles on top, the cortex, and the insula right there. The internal capsule right here. It's very simple, does not require any manipulation, and it is quite effective, as you can see. You cannot clearly measure the posterior horn right there, but the fact that it is completely filled by the choroid plexus tells you that it is of normal size. Now, if this baby is vertex, the only way that we have to take a direct look at the corpus callosum would be either by manipulating the head or by doing a vaginal scan. We'll try some manipulation. I'm going to push a little bit on the baby to see if I can move it. So I am putting my hand on the occiput of the baby, and I am making some pressure. The baby is not so happy, as you can see. But life is difficult. Can you see the image? Life is difficult. Better to learn it since the beginning. And as you can see, the view is excellent because you have the big acoustic window of the metopic suture right there. And you can see very well the entire corpus callosum in its thickness, the cavum septipellucidi, and you can see the brainstem, and you can also see the cerebellar vermis and the fourth ventricle. That is perfect for the soft palate as well. Lot of activity going on. Even if you are not doing a vaginal scan, as you can see, with some very mild manipulation, believe me, it is very mild, you can see very well the cavity of the lateral ventricles, the choroid plexus, the midline structure, and, okay, can you freeze the image right here? Even the cavity of the fourth ventricle, most likely. It is a little bit difficult to be completely sure that we are exactly on the mid-sagittal plane, and that is really the cerebellar vermis. Can we put on some color? Maybe we can decrease the gain a little bit. Okay. And you can see vascular anatomy helps a lot to understand. You can see very well the vein of Galen, the straight sinus going down all the way. You can infer the position of the tentorium from the straight sinus. And you can see that the cerebellar vermis is closing completely the fourth ventricle, lying against, so the angle is really 0. Can you switch off there? And if you angle a bit the transducer, then you can see both hemispheres. And the CDL for how many weeks are you? 24 weeks. That's an ideal time, of course, to scan the brain. Okay, are there any questions?
Can you show the fornices when you go downward?
Sure. Okay. Can we blow the image up a little bit? Great.
I asked him to show you the fornices a bit lower than
Okay. Do we agree that this is rectangular, but it is not the cavum septipellucidi? Just 3 lines. These are the columnae fornices. So I'm starting from top, cavum septipellucidi, frontal horns, and these are the 2 columns of the fornix and the midline in between. At this level, you don't see the frontal horns anymore. So you should not mistake these with the cavum septipellucidi. That's the cavum. These are the columns of the fornix. And if you go coronal, you can see it very well. Actually, the anatomy is slightly more complex than we assume, because with very high resolution, you can see that the cavum septipellucidi in reality is like a triangle. The fornices, the cavum septipellucidi, the walls of the frontal horns.
Enough to say that the corpus callosum is partly this anterior.
Well, if you can see this, the cavum septipellucidi, part of the corpus callosum must be there. It may not be complete, of course, but part of it will be there for sure. Third ventricle, right there, is a bit complex. There is the massa commissuralis right there, which is decreasing the bulging inside. It's from here to there. Thalami, internal capsule. The hippocampus right there, important structure, been mentioned before, with the quadrigeminal cistern here and the hippocampus there. Are we all right?
Yeah.
Thank you very much. Thank you. It's a very nice paper.
Now we'll change machines. We'll change machines now and change patients. And Bernard will try to do the face with 3D and show you other things as well. Macht nachher für Sie Bubble. Okay, dass Sie wissen, ja. Roland, kannst du bitte stecken hinten, dass wir dann mal umstecken? Sicher. Ah, schon, okay. Do you have questions? Of course, the patients were chosen to be the question is what frequency had that problem?
3 to 10.
3 to 10. Yes. The question is optic chiasma. We'll try to check if it's possible. Roland, come here. Hier ist schöner als dort.
It's better on the screen. You have it.
Ja, wir machen mehr als Bilder. Nachher, wenn wir fertig sind, macht er für Sie Bilder und CDs und so weiter. Aber für die Show, für die Demos, machen wir jetzt für Sie auch. Trotzdem das Bild. Ja.
It's okay. Rabi,
Oui,
we
yes.
can start?
Yeah, I'm waiting for you.
Okay. It's on the screen?
It's on the screen, yes.
Okay, so what I do, I start with abdominal probe, convex one. So this is the head. So I will try first to use a 3D. So for this, I need to move the baby. So I use my second hand. It's okay. And I will try. It was okay. So okay. So because of this, what I will do, I move to the spine. Okay, you have to be opportunist. And this is a spine with a standard probe, and you can see here the conus medullaris. And I will do it with the high-frequency probe, the linear probe. Now we move. And here, this is the conus medullaris here with the central canal. We can see all the parts, and here you can see the nerves here. So the baby is moving, yes. Okay. I will try again the face. Okay, from this position, I start with 3D from this position, acquisition. And this is a part of the face, so I have to cut what is in front. But it's difficult to remove this, so I will do another acquisition. Yes, but I will do later. So I use my second hand, and I do the switch with the foot switch. Go. It's okay. The mud. Okay, so you can see the nose, the lips. Because of the position, I will demonstrate how to see the skeleton. For this, I use VCI with a special setting for the bones. You just have to put this line on the skull. And this is a 3D rendering of the mandible here. And you can see here zygomatic arch and all the sutures. This is a posterior view of the skull. So if I do the same like this, what will be the result? It will be the display of the occipital bone. This is a posterior view, a side posterior view of the occipital bone. This is a parietal bone. And this is a large suture, and it's why it's possible to see the brain, because when you do the scan axial view, this is a window where you can go and see the brain. When you have a nice view of the brain here, it's only because you are inside this suture. I move back. The skull. Yes, c'est pas pareil. Yes. Now, I will show you how to do a good acquisition to obtain the corpus callosum inside. My method is quite similar to Pilou method, but I prefer to put inside the original plane, the cerebellum here, the middle line, and the septum pellucidum on the entire part. And I have to put this on a horizontal line. So I choose acquisition of volume with quality I1, and I start acquisition. The baby was moving a little bit inside, but we will try to find it inside. So first, I put the brain horizontal. Also, you can work with a multiplanar view. And from here, what I will do, first, I increase the thickness of the section. So with this, we can increase the quality. Okay, and now rotation. Increase again. And this is a corpus callosum. You can do a measurement here. And this is not only the corpus callosum, this is the septum pellucidum. And the corpus callosum is the roof of the septum pellucidum. The corpus callosum is here, but you can do a measurement. And the measurement of the corpus callosum after 22 weeks, after 20 weeks is always more than the number of weeks. And this is the central part of the cerebellum, the vermis. And this is not fluid, it's only a shadowing of the bone of the base skull. Okay. Now I will move to the linear probe. So first, look at this. I will take one picture, this one, with, we are at 10 centimeters. This is a picture made with this probe. And I will do the same with this is with high frequency probe. You can see you have not too much difference. The penetration is really good. But in this case, I use virtual convex, but I don't like to use it too much because the quality is not so good. I prefer to use this one. The quality is better. And we can move inside the brain. I will push the head, the nose, lips, nostrils. I am sorry, but I have to push hard to move. Okay. And you saw this. Now I am playing with a cine loop. And this was the posterior edge of the hard palate. I will do it again from here. This is a tongue. And here, okay, freeze. This is the posterior border of the palate. So it's not difficult to obtain. Just you have to start from the profile, turn 90 degrees, 2 orbits. I don't need freeze, I don't need. And you move slightly, and here you can see the posterior border of the palate. And this is the tongue, this is the mandible, and this is maxillary with the alveolar ridge. This one is only around 24 weeks, so it's not possible to, I will try to do it anyway. This is, we can see the eyes lid, it's closed. At this stage, the baby cannot open the eyes lid. It's not possible, it's all the way after 26 weeks. So we can see here the lenses. But it's a little bit too early to demonstrate you the pupil. And on my lecture, it was a fetus at 32 weeks of pregnancy. Chiasma. This is the place of the chiasma. I will take another setting, this one, with, because of the, so this is a chiasma. I am not in the correct plane, but this is a chiasma. And when you turn, okay, here, and the baby is moving. And if you want to, I will take this one again. We can use the color Doppler. Here, this is a chiasma. Rabbi, are you satisfied?
Yeah. What did you say? Why satisfied? I'm satisfied. L'œil avec le nerf optique, tu peux le voir? Gustavo, do you agree?
So I move to the eye socket. Okay, optic nerve. Here. And look at this, because it's early in the pregnancy, it's around 22 weeks, we can see, at this stage of pregnancy, you can see a remainder of the yelloid artery behind the lenses here. So he asked me to do a corpus callosum. So first I have to put the fetus in the correct position. So I push the head and zoom maximum.
Passe un peu par derrière. Comme ça, ouais. Plus un peu plus horizontal.
Non. Non, enlève, je continue.
Plus par derrière.
Yes, it's difficult to push too much. This is a vermis. Yeah. I will save picture after.
Somebody changed it and they have Daikon transfer on people.
So I move back to the face, 3D. face. And this is a standard surface rendering, and now I will apply the new HD Life, and I will show you how it works. You start from here. You change your setting to render mode, this one, and here you just have to move the position of the light. And it's always better when the light is coming from the upper part of the head. And this is nice also if you want to do the skeleton again, but the visualization of the metopic suture. No, no more. It just turned. So, thank you.
Thank you, Bernard. Bernard will be doing some